Hi everybody, we're going to pick back up with nervous system. This will be our last chapter covering it. This information begins in your course pack on page 121. So this topic is going to be the autonomic nervous system, and we'll talk some as well about the somatic nervous system. Just a reminder of where we've been and where we're going. We've talked about the brain and spinal cord. In lab, you talked about cranial nerves. We've also talked about spinal nerves. So we're now talking about the motor division. That is a functional division that's divided into an autonomic branch, basically it's an automatic branch, and the somatic nervous system branch. You can see in this image that the autonomic nervous system subdivides into the sympathetic division and parasympathetic division. Those will all be our topic today. So back when we talked about the process that occurs in our nervous system, we discussed that sensory input comes into the central nervous system. That includes brain and spinal cord for processing. The processing occurs at interneurons. Interneurons then initiate motor output that travels to effector organs, such as muscles or glands. So our discussion today will focus on motor output, whether it is autonomic, which means it's automatic or involuntary, or somatic, which means it goes to the control of skeletal muscles. So motor output is organized in two ways. If it's voluntarily controlled movement of skeletal muscle, we say it's under the operation of the somatic nervous system. However, if we're talking about the autonomic nervous system, we're talking about an involuntarily controlled or automatic system. The parasympathetic and sympathetic nervous system branches come off of that autonomic nervous system. So let's talk about the differences between the somatic nervous system and the autonomic nervous system. We know both control motor events. That is key to keep in mind. The somatic nervous system controls voluntary motor events, while the autonomic controls involuntary events. Voluntary events controlled by the somatic nervous system include movement of skeletal muscles. Those are things that you can consciously control. For the autonomic nervous system, smoothing cardiac muscle control is under the guise of being involuntary or automatic. Now, looking at the SNS, it is a fast system. Why? It's because it's a one neuron system. The autonomic, by contrast, is slower. It's because it's controlled by a two neuron system. Now, we haven't discussed 1 versus 2 before. I'll show you what that looks like in just a minute. Now, the SNS is using basically acetylcholine, while the autonomic nervous system can use acetylcholine, also epinephrine, and norepinephrine. Finally, the somatic nervous system is under the control of your primary motor cortex. You may recall that's housed in the frontal lobe, in the precentral gyrus. By contrast, the autonomic nervous system control originates with your hypothalamus. You may recall that's the home for homeostatic control mechanisms. All right, so here you're looking at somatic versus autonomic. For starters, you'll notice here we have control of somatic nervous system in the primary motor cortex. That, of course, comes down the spinal cord and travels to our skeletal muscles. That's voluntarily controlled. By contrast, the autonomic nervous system originates with its control in the hypothalamus. That nerve impulse travels down the spinal cord, but this time it travels to visceral effectors. These would be glands and organs that are involuntarily or automatically controlled. So let me take you over to page 122 for just a moment, and we will look at the difference between the autonomic and the somatic nervous systems. In order to understand this information, you should read the checklist on the bottom of page 121. Go back and review any terms there that are unfamiliar. We've covered those this semester, but if they've escaped your brain between the time we talked about them and now, this is a good time to review before you dive into page 122. So you're looking at a spinal cord cross-section, and you're looking at a neuron traveling away to an effector organ. So with the autonomic nervous system, we call this a two-neuron system. So we know that autonomic nervous system control originates in the lateral horn of the gray matter. And that's what we see here. That's the cell body right there. And you can see the axon traveling away. These are dendrites that synapse over here in a ganglion. So this structure here, it's called a ganglion. All right, so this first neuron here is called our preganglionic neuron. And it synapses with the ganglion. The second neuron originates in the ganglion. It travels over here to the effector organ. So that second one is called a postganglionic neuron. That's why we call this a two-neuron system. There is a preganglionic neuron and a postganglionic neuron. But here's the lie. There may be hundreds of neurons inside that ganglion. Now, we simply just say, because there's a ganglion here, there's only two major neurons. The neuron leading from the spinal cord to the ganglion, that's preganglionic, and then there's a postganglionic neuron leading from the ganglion to the effector organ. So because there is a potential for there to be a slow speed of transmission among these many synapses, we say that this happens to be a slower system than the somatic nervous system. Let's talk about your somatic nervous system. Here you can see a representation for the spinal cord right here. You can see a neuron originating there, and it travels directly to the effector organ, which here is your skeletal muscle. And there are no ganglions here. There are no preganglionic or postganglionic neurons. It is simply a direct route from the spinal cord to that effector organ. Therefore, this is a faster system because of this setup. So here, let's take a look. We know that somatic nervous system control comes from your ventral horn of gray matter. And the motor neuron that travels away originates in that gray matter. It travels out through the ventral root, and it synapses over here with our skeletal muscle. Because there are no ganglia here, there's no pre- or postsynaptic neurons here, we simply say this is a one-neuron system. And because it is one neuron, it is truly a faster system. Now, no hidden information here. Whereas a two-neuron system may in fact include hundreds of neurons, this is truly a one-neuron system. So in this image here, you may just simply recall that we have a lateral horn sticking out about here. That's for autonomic control. And right here, we have that ventral horn. That is for somatic nervous system control. Let's now further divide the autonomic nervous system into a parasympathetic and a sympathetic division. This is still motor output, so we're talking about the control of involuntarily controlled organs and glands. All right, so the sympathetic nervous system is a setup as you see here. You'll notice that we have neurons coming off of the thoracic and lumbar regions of the spinal cord. Now, those neurons are very short. In fact, all of these colored red right through here and right through there have very short preganglionic neurons. The black colored neurons, which lead over here to the organs, are actually longer. So we say that there's a short preganglionic neuron and a longer postganglionic neuron. The ganglion is right here. You'll see sympathetic chain ganglia, and they actually sit closer to the spinal cord. Now, if you've ever heard gut reaction, this really comes from being a sympathetic response. The thoracic and lumbar spinal nerves control all the organs that you see here, everything from heart, lung, digestive organs, urinary bladder, reproductive organs, even skin. So when you talk about a gut reaction to something, it is those thoracic and lumbar spinal nerves that are creating that reaction. They do so by releasing epinephrine and norepinephrine onto these target organs. So sympathetic nervous system response includes increased mental activity, increased metabolism, increased heart rate and blood pressure, respiratory passageways dilate. You'll activate your energy reserves and sweat glands will activate, but you'll decrease your digestive system functions. So in other words, you increase the activity of those organs in your thoracic cavity while decreasing the activity of those organs in your abdominopelvic cavity. So let's talk about what will put you into sympathetic nervous system mode. If you've ever been driving down a road and been somewhat sleepy, you may find that you're drifting across the line, maybe into oncoming traffic. All of a sudden, you hear a horn blaring at you, and you're startled awake to realize that you have drifted into oncoming traffic and into the pathway of an 18-wheeler. All of a sudden, you're wide awake, you can completely function, you aren't sleepy one bit, and you have just experienced emergency. That's one of these E words here that are paired up with the sympathetic nervous system. You are now in what is called the fight or flight response. Either you have the energy to put up a fight or to make a flight and run for it. Exercise, excitement, or emotions like that, embarrassment, and emergency can all trigger you to be put into sympathetic nervous system response. So immediately, you're wide awake, your heart beats faster, your digestive system activity slow because, hey, if you just had a meal to eat, this is now a life or death situation. Digesting that meal can wait. So we shunt blood to areas where it's most important for it to operate. Let's talk about the parasympathetic nervous system. So the parasympathetic nervous system works off cranial nerves and sacral nerves. You can see the cranial nerves here that travel off the base of the brain and spinal cord, while the sacral nerves are the ones that are closest to the tail end of your spinal cord. One of the most important members here is cranial nerve number 10. Do you recall the name of that one? That one's the vagus nerve. All right, so parasympathetic preganglionic neurons are long, while they have short postganglionic neurons. So here, these are all preganglionic neurons. They're colored red, and these teeny tiny postganglionic neurons are black. They're far away from the spinal cord. You can see here the ganglion is also far away from the spinal cord as well. So when we talk about parasympathetic anatomy, we say the craniosacral nerves are the ones responsible for controlling this setup. In fact, the vagus nerve is probably the biggest contributor to parasympathetic control over the digestive organs and the heart and lungs. So when vagus nerve is in control, you're relaxed. That means that your heart rate decreases, your digestive activities will increase, and you're seeing acetylcholine play the major role here. You'll notice that parasympathetic nervous system activities promote a decreased metabolism, decreased heart rate and blood pressure, increased digestive activities, and increased urination and defecation. Those processes can take place. So we think of this system as the rest and digest system because your body is in a restful state and it's promoting the processes like digestion, urination, and defecation. So if you've ever heard of mind over matter, take a deep breath and relax. That is this nervous system branch here. If you've ever been really excited or embarrassed and you're in emergency mode, somebody might say to you, it's okay, take a deep breath and breathe. What they're trying to do is move you away from sympathetic nervous system toward this parasympathetic, which is our rest and digest system. That will bring your heart rate and your blood pressure down. This system dominates D activities like digestion, defecation, which is having a bowel movement, and diuresis, formation of urine. So let me give you an example here. If you've ever had a large meal for Thanksgiving, oftentimes people love to take a nap after a large Thanksgiving meal. When you get sleepy after a large meal, the blood is actually traveling to your digestive organs to aid in digestion. The blood travels away from organs like your heart, your lungs, and your skeletal muscles. So during this kind of relaxed state, you're going to be in a parasympathetic mode. So this is actually the underlying reason for us being cautioned against swimming after a large meal. If your blood is traveling to your digestive organs and not to your heart, lungs, and skeletal muscles, what does swimming do to your body? Well, that's an E word, exercise, and that forces your body to have to make a decision. Do we send the blood to the digestive organs, or is the blood better off being sent to the skeletal muscles? And so you're actually forcing your body to have to make this decision, and that can result in muscle cramps. At the very bottom of page 123, let me draw your attention to this chart. We've actually talked through this chart already. The sympathetic nervous system division involves thoracic and lumbar spinal nerves. We call that thoracolumbar region. We know there are short preganglionic and long postganglionic neurons in that particular division, and the ganglia are close to the spinal cord. By contrast, the parasympathetic nervous system involves cranial nerves and sacral spinal nerves. So craniosacral is sometimes how we refer to this one, and I'll jot that word down here for you. Now, there are long preganglionic and short postganglionic neurons here because this particular system has the ganglia closest to the visceral organs. Let's take this a step further by talking about the neurotransmitters that play a role for each of these divisions. Over on page 124, you notice there's a chart there. Let's talk through this chart by understanding that there's two major kinds of neurotransmitter receptors on the organs that are receiving messages from the parasympathetic and sympathetic nervous systems. Some receptors are called adrenergic receptors because they bind epinephrine and norepinephrine. Keep in mind, adrenergic sounds like adrenaline. Adrenaline is just an alternate name for epinephrine. Noradrenaline is an alternate name for norepinephrine. Sometimes for short, we call epinephrine epi, and we call norepinephrine NE. Okay, so I'll just jot those here for you. Now, there are certain receptors that bind these kinds of neurotransmitters. They are called alpha and beta receptors. Let's talk about the other kind, cholinergic receptors. Cholinergic receptors bind acetylcholine. And of course, that's where the name comes from. You can see choline here is the second part of that word. Now, these receptors that bind acetylcholine are called nicotinic and muscarinic receptors. So let's recap. These neurotransmitter receptors respond to parasympathetic and sympathetic nervous system directions. Keep in mind, these two systems are motor control divisions of the autonomic nervous system. So, depending on what receptors you have on what organs and which neurotransmitter is present, you dictate to that organ what its job is supposed to be. Either you're telling that organ to rest, or you may tell that organ to speed up to increase its activity. Thinking back to earlier discussion in this course, the receptors that we're talking about are actually on the surface out here. This surface out here is called the glycocalyx. So these receptors bind the neurotransmitters and carry the message to the interior of the cell. There are two types of adrenergic receptors, alpha receptors and beta receptors. Because they use the word adrenergic, they imply that these kinds of receptors are binding epinephrine and norepinephrine. Keep in mind these two receptors are working primarily for the sympathetic nervous system. You can see in this picture here we are looking at an axon terminal. And of course this is a synaptic cleft right here. And down below we have a postsynaptic neuron. So alpha receptors can either excite or inhibit cellular activity, whereas beta receptors typically excite. So think about this for a moment in terms of the big picture. Because these two receptors primarily bind epinephrine and norepinephrine, and they work for the sympathetic nervous system, what organs become excited under the sympathetic fight or flight response? Well, that would be heart and lungs. So a lot of your alpha and beta receptors, in fact, sit on the heart and lungs. When the neurotransmitter binds the receptor site here, then we are looking at excitation inside that cell. Now, alpha receptors may inhibit cellular activity. If you've ever heard of alpha blockers or beta blockers, these are drugs or medications that go and sit on those binding sites and prevent epinephrine or norepinephrine from binding. If the goal of epinephrine and norepinephrine is to excite the cell, what do you think the beta blocker does to the cell? Well, the beta blocker will block excitement. Likewise, an alpha blocker also can block excitement. Now, I take a beta blocker because I have an overly excited heart. I have a heart condition called supraventricular tachycardia. In plain English, it means I have a fast, resting heart rate. So the beta blocker blocks the effects of norepinephrine on the heart. By nature here, that's going to block the effects of norepinephrine and creating excitement in the heart. So it lowers my resting heart rate closer to 75 instead of what normally would be about 100. Alpha receptors may in fact allow for us to change the activity inside the cell. They can cause cramp. All right, so the autonomic nervous system cholinergic receptors are going to bind acetylcholine. You'll notice that acetylcholine typically acts on muscles like the skeletal muscles. That is the case here for the somatic nervous system. In the autonomic nervous system, you'll notice that acetylcholine may have an impact on the cardiac muscle tissue, for instance. Otherwise, we have acetylcholine acting as a neurotransmitter at the ganglion, like you can see here. Nicotinic and muscarinic are the two types of receptors that bind acetylcholine. These are cholinergic receptors. They are, in fact, channels. Back when we studied nerve impulse transmission, we did not name these, but they, in fact, were cholinergic receptors. This is an old story. You can see here that acetylcholine binds to this site on the receptor. It is a sodium channel, and of course, that channel opens and allows sodiums to enter those muscle cells or whatever our target organ may be. Since these are built to excite these cells, then we're looking at some of these cholinergic receptors being found on our digestive organs. Muscarinic receptors can either excite or inhibit the cellular activities, so these, you'll notice in your sheet, can be found on digestive organs or even on the heart. So here's a summary of what we've talked about so far. We've got two types of adrenergic receptors. They are considered to be alpha and beta. We have two types of cholinergic receptors. They are nicotinic and muscarinic. You can see that alpha receptors typically bind epinephrine and norepinephrine, as do beta receptors, whereas cholinergic receptors only bind acetylcholine. Last thing for us to discuss here is just a little bit of information on sensory input. If you'll flip on over to page 125 with me, let's talk about the sensory division, which is a functional division here. So, some sensory receptors are considered to be free nerve endings, like those that we find in our skin. Others are encapsulated, like we have in our eye. Some sensory receptors pick up information from the outside of our body, such as exteroreceptors or exteroceptors. We also have some inside our bodies known as interoceptors. Proprioceptors are found only in our joints and muscles that allow us to know where that joint is in space. Sensory receptors may be discussed as tonic or phasic. Tonic receptors are always on. Phasic receptors cut off because they can adapt to their environment. Let me give you an example. If you walk into a house and someone has baked a cake, the first few minutes you're there, that's a great smelling cake. After 5 or 10 minutes, what cake? You don't smell it anymore, right? So these phasic receptors can cut off. They'll stop telling your brain what they're sensing, so they can experience adaptation. Basically, the neurons hyperpolarize so that there is no need for the same impulse to be sent to the brain. So some neurons are considered phasic, while others are considered tonic. Pain receptors are tonic, meaning they're always on. And other kinds of receptors, such as, say, an olfactory receptor, may be phasic in nature. We can also classify our receptors by what they are stimulated by. Nociceptors are considered pain receptors. What do you think thermoreceptors detect? Temperature. Mechanical receptors or mechanoreceptors pick up on everything from touch to pressure to joint movement. And chemoreceptors pick up on chemical concentration in the bloodstream. As you go into Bio 211, we will talk about baroreceptors and chemoreceptors, since they're going to be a major part of us regulating things like blood pressure and blood pH. So in our skin, for instance, we have several types of receptors that pick up on everything from temperature to touch and pressure. And here you can see an example of some of the tactile receptors. Hopefully, remember some of these. We discussed them way back in the integumentary system chapter. We talk about the lamellated corpuscle here, Ruffini's, which detect tearing and stretching, and we also talked about Merkel or tactile discs, which is for fine touch. Of course, baroreceptors are important for detecting pressure changes in the body. Everything from a full bladder to an overstretched vessel is picked up by a baroreceptor.